What is real healthcare and how can it be sustained? It is about how we can use the opportunities that we have before we lose our health, before chronic diseases strike us. Health is very important. It is much more important for a person to love and respect themselves. Hello everyone. My name is Professor Dr. Mehmet İlke Yilmaz. I am a specialist in internal diseases and nephrology. Approximately 5 years ago, we set out on a journey with the motto, One Knowledge, One Life, to touch wise lives. Our aim is to know that everyone is a wise person, and to host them in their wise lives by considering their lifelong experiences and the difficulties they have experienced from time to time, and to look for solutions to their health problems. And at the very beginning of these solutions, to look at a person as a whole, not only physically. That is, not only because they have chronic diseases such as Alzheimer's, dementia, cancer, renal failure, diabetes, hypertension, but also to evaluate the person both mentally and socially as a whole and to help them to hold on to life and move forward in life together. Yes, we set out with this thought and these feelings, and we tried to touch the lives of those people in the course of 5 years. Yes, touching lives was important, and the most important part of touching lives was this: basing everything on knowledge and integrating that knowledge with knowledge and being able to serve people to be healthy and happy. Yes, indeed, Bilge Hayatlar is an institution established around this concept and operating with this mindset. Our goal is to provide professional medical assistance with our doctors, nurses, physiotherapists, dietitians, and a host of healthcare professionals, as well as patient care services, all complemented by a highly skilled administrative staff. We strive to serve our clients and guests here, and we continue to work towards this goal. Do you know why this is Bilge Hayatlar, wise lives? The reason is that human beings are actually wise in the process they live. It has nothing to do with age. A 3-year-old child is a wise person, and a 100-year-old grandfather or grandmother is still wise. Yes, the experiences of those people make those people wise, and we, as the Bilge Hayatlar family, aim to provide services together with many health professionals fully equipped to solve the problems they have experienced throughout their lifetime. And in line with this goal, we have been trying to provide health services on a 24-hour basis for 5 years, together with our physicians, nurses, physiotherapists, dietitians, and all our administrative staff. Yes, Bilge Hayatlar started its journey 5 years ago with the motto, One Knowledge, One Life, and today it is determined to continue its journey in its 5th year. We hope that as a member of the Bilge Hayatlar family, when you or your loved ones encounter any difficulties in terms of health, both mentally and socially, we are here to provide a boutique service with a professional but never neglecting an amateur spirit, and always with the warmth of a family. I want you to know that I am very happy, peaceful, and proud to be here, serving you and your loved ones within the Bilge Hayatlar family. Yes, when we talk about health tourism, in fact, if you look at it, it has both a domestic and an international aspect. When we set out on this journey, we actually aim to serve our clients both domestically and abroad in terms of health tourism. And here, we also aim to provide health services to all our citizens living abroad, especially those who come to Turkey as expatriates, both individually and for their family members. While doing this, especially when individuals or their family members experience a health issue during the summer or any other season, we provide as Bilge Hayatlar 24/7 healthcare with a family-oriented, boutique approach that supports individuals socially, physically, and mentally, especially to Turkish people living abroad and their families. In this regard, we are an institution that serves individuals who come here from various European countries, Asian countries, and various centers from around the world, including African countries, without making any distinctions or discriminating based on nationality or specific medical conditions. We operate 24/7 to continue providing them with healthcare services or to respond instantly to any immediate health concerns they may have. As an institution, especially in the last 5 years, we have been helping people from dozens of countries, whether Turkish or foreign, together with all their families. I want to emphasize this point, because health is not only about the individual. When there is a health problem, all family members are affected, and it is not easy to manage this process. That's why, as the Bilge Hayatlar family, we aim not only to provide healthcare services for individuals but also to inform every other family member about what is being done in terms of their own health services, and to provide information on what they can do in the future, considering that they may also encounter these issues. We have been working on this and continue to do so. Therefore, I believe that we have filled a significant gap, especially in terms of medical tourism. As a boutique institution in this regard, we aim to continue this process in collaboration with other esteemed institutions, spreading this approach across the entire country. We want to emphasize once again that as the Bilge Hayatlar family, we are committed to making every effort and assessment to ensure that Turkey rightfully earns its place as a leading country in the medical tourism market, further developing this field. Of course, when individuals experience health problems, it is natural for them to seek both a physician and a healthcare institution they can trust and entrust with their patients. This issue is very important for all of us when we empathize, because we have to entrust our precious lives, our mothers, our fathers, our siblings, our spouses, or ourselves here. Therefore, I would like to emphasize that Turkey is actually ahead of Europe and many countries of the world in terms of medicine and medical services. However, I believe that in this regard, our healthcare professionals and the hospitals and other institutions providing services in this field need to be more detailed and collaborative. In my opinion, their efforts in this direction will be the greatest assistance in advancing our country's medical tourism sector. The Ministry of Health of the Republic of Turkey has already done very valuable work on this issue and coordinates this work with other ministries and supports many institutions in the country in this sense. I also appreciate for that. However, we have platforms where other institutions come together to discuss what can be done together with other institutions in this regard. We would like to express our thanks in this regard. However, how can we really have a health service, and how can we sustain this health service with a little more devoted, a little more professional help on what can be done in this regard? I want to say something about this. It is not a problem to provide health care. We already have very valuable institutions in this regard. But the sustainability of this is very, very valuable. Because when a person returns to their hometown or country after receiving healthcare services here, they may encounter a person or institution who will address the difficulties they may experience during the course of that problem again, and I believe this is the most valuable part of the process. Because we can all have many surgeries in terms of health. We experience different operations, different health-related activities, and their positive processes for us and for the patient. We are discharging them from here in a very good condition and sending them to their hometowns. But in the process, after all, we are human beings. We can find ourselves in a health problem at any moment. In this regard, I believe it would be more meaningful to re-establish contact between that institution and that individual, with the aim of improving their current health problem, providing higher quality healthcare, or ensuring that the individual receives better healthcare services. This could perhaps be achieved by bringing those institutions together again through our ministries or associations, ultimately leading to a more valuable and significant outcome. Therefore, when we consider Turkey in terms of healthcare, with its hundreds of medical faculties, universities, and state hospitals, there are truly dedicated healthcare professionals who provide high-quality services and work tirelessly in this field. I believe that it would be valuable and possible for us to receive more support, to be brought together more often, and to create a shared knowledge pool by gathering ideas, especially for the development of health tourism from abroad. This way, the process can be better managed and sustained, making it more effective. Now, of course, the most important part of the issue is to come together. In this regard, the activities of USTTAK are very meaningful and valuable. I would like to thank them privately for this. In this regard, I would like to express my gratitude once again to the esteemed USTTAK executives and employees for bringing us together, as well as for incorporating the valuable experiences of various institutions. This will undoubtedly contribute to improving and making this process more sustainable. And here, altogether, making the health tourism. Because health is very important since we all need it someday. I would like to express it in this way. Unfortunately, we are at a point where we seek healthcare services only after our health has deteriorated, mainly because we didn't pay a price for it in advance. Let's come together, starting with the USTTAK family, and develop wonderful projects where people can come and acquire information without being sick, without encountering those problems. Let's encourage people to come here without having health issues. And here, let's assure them of this and say the following: health is of utmost importance. Loving and valuing oneself is even more important. Together, we have acquired knowledge on how to use the resources available to us and how to avoid becoming ill before losing our health or facing chronic illnesses. I think in this sense, if it is put next to health tourism, which I think is much more important than providing health services, then we can transform the world into a more livable, prosperous, and healthier place, where healthier minds and healthier individuals live and are nurtured. In this regard, as the Bilge Hayatlar family, we would like to express our unwavering support to the USTTAK executives in making this sustainable project initiated by them even more successful, and we extend our gratitude to them.